This week, the High Court ruled that government policy on discharging untested patients from hospital to care homes at the start of the COVID-19 pandemic was unlawful. The legal challenge was brought about by Dr. Kathy Gardner and Faye Harris, who both lost their fathers to COVID. The two said there had been failures in protecting elderly care home residents from the virus, with Dr. Gardner saying the homes had been neglected and let down by the government. So, Paul, do you think that this was the right ruling?
I think it probably was. I think the broader question, Deanna, in many respects, is why didn't we go for that much more targeted approach from the very outset? I mean, the truth was, COVID has only ever presented a threat to a small minority of people in terms of people who suffered serious symptoms or were at risk from dying. Now, I don't say for a moment that means we should, leave those people to their own devices or forget about them. I argued at the outset that what we should have is that targeted approach where we threw a shield effectively around the most vulnerable people in society, such as those in care homes, while allowing the rest of the nation to go about its business. But what we effectively did was quarantined the entire population, even though the vast majority of the population was healthy and were under no personal threat from COVID. So, I mean, I have to say, I think that was a fundamental failure from the beginning. And I think now the bill is landing in many respects. What it meant in terms of that hard lockdown and not taking that targeted approach by ring fencing people in care homes and other vulnerable people is that we've got a national health service crisis, we've got a backlog of operations, we've got undetected cancers and heart disease, etc. We've got the economy having been hit in a serious way and businesses now going bankrupt and people having lost their jobs. So yeah, in terms of the ruling, fine, but I think we need a much broader debate about hard lockdown and what the implications have been.
Yeah, no, I think I'd agree, and it's something that we've discussed quite often on this show, isn't it? I guess one of the difficulties, kind of looking back to this specific story and people kind of being discharged without testing, is when you're thinking back to the very early stages of the pandemic, when we knew very little about this virus, when we didn't really have test capacity, do you think we can kind of understand why some of those decisions were made prior to us having all the knowledge and capacity that we needed?
I mean, look, there's no question that the government were dealing with something quite new. They were almost operating from hour to hour in many respects and making decisions on the information that was in front of them. So, of course, in a situation like that, where you're dealing with a novel virus in that respect, then mistakes will be made, and I think we have to accept that mistakes were made right across the world in many respects. However, what I don't think is excusable is effectively following the Chinese model of lockdown. I mean, some of the government advisors have openly said that we followed that model. We didn't at first think we could get away with it because the regime here and the culture here isn't as authoritarian as it is in China. But then it looked like we might get away with it. That's what we decided to do. And as I've said before, there was enormous mission creep throughout the period of lockdown. It went from squashing the sombrero and then we'll all get back to normal to then, making sure everyone was vaccinated before we got back to normal. And that kind of just seemed to run for months. And I think if you look at countries, Sweden and Japan, for example, which didn't lock down as hard, then they don't seem to have actually done any worse than us. So there's a number of questions there.